Good afternoon, everybody, and thank you for coming to our Autism Consortium meeting today. I just have a few housekeeping items coming up. Our next meeting will be held on Monday, December 5th at 2 p.m., where we're going to give an overview of our program E4 Texas. That is a program that works with post-secondary adults with and without disabilities. Through the Texas Center of Disability Studies. And so we're excited to learn more about that. Also, around the end of the seminar, I will place a link in the chat with a survey just to briefly go over your experience here today. And please take a moment to fill that out. And then also, we're excited, we're going to be changing the format of this a little bit for the spring. We are going to be trying a spring hybrid lunch and learn format that will be held on the second Friday of each month at noon from 12 to 1:30 p.m., both on Zoom and in person at a location yet to be determined at UT. So you'll be getting more information about that soon. And if you're a researcher who's interested in presenting in the spring, or if one of your colleagues are, please have them get in touch with me directly at kate.thompson@austin.utexas.edu. And so now I will pass this over to Sandy.
Welcome to our presentation. I want to say a few words about Paul. And I'm sorry you can't see me, but my camera's not working well. But Paul and I have known each other for quite a number of years. He was a PhD student when I was a professor in the School of Social Work at University of Wisconsin-Madison. And he also did his postdoc there. And we both have sons about the same age. So they did some activities together back in the day. It was kind of fun. But I do want to say that Paul, I mean, he's had such an amazing trajectory. But even his dissertation was groundbreaking. One of the things Paul looked at was very controversial at the time, but everybody was trying to figure out why is there such an increase in diagnosis of autism. And his dissertation actually had data that showed sort of a substitution effect between where the diagnosis of autism was going up and the diagnosis of intellectual disability going down. And since that time, I mean, other people have confirmed that data, and looked at new data that really confirms that. But it was really controversial at the time. I mean, he published his first paper in pediatrics and got a lot of feedback from people about it. But then, Paul went on to Dr. Shattuck. Paul went on to, to Washington University in St. Louis and did some great things there. And then Drexel started the Lifespan Center there for autism and has done just amazing work related to adults and sort of across the lifespan, looking at across the lifespan. And, there's still not enough research in that area, but he was really one of the pioneers of getting research going in that area. And now he's at Mathematica and doing great things with looking at community services and impact and really policy level stuff. So really excited to hear what he has to say today. And I'm going to turn it over to you, Paul.
All righty. Thank you for that very kind and gracious introduction. Sandy and Kate, thank you both so much for inviting me. Kate, let me just touch base for a second, make sure I understand the logistics accurately. Do I understand accurately that we have a 90-minute slot overall, and I have like maybe 45 minutes or so to present, and then Q&A?
Sure, that's 90 minutes overall. Typically what we do is presenting around an hour and then with some time for Q&A at the end, but that can be, there's wiggle room on either side of it.
All right.
45 minutes is perfect. Yeah.
It looks like we have a fairly small group today, so I want to encourage folks to go ahead and interrupt me along the way. I'm quite content and happy to take questions as we go, or I'll take your questions at the end. I'll just start by saying
real quick about that. I'm so sorry to interrupt.
Yeah.
So in the webinar format, if anybody has a question, please feel free to drop it in the chat or the Q&A, and I can read that out loud.
Oh, there you go. Okay, that situation. Very cool.
Yeah, no problem. If you prefer to speak your question, you can just make a note of that in the chat as well, and I'll unmute you.
Oh, that's cool. Okay, great. We'll save the questions for the end. That's awesome. I just want to preface a couple of general comments before I launch into my slide deck. I love what I do. I feel so blessed. You know, I got the great honor and privilege and pleasure of working with Sandy and other colleagues when I was a doctoral student and an MSW student at Wisconsin. Learned so much under Sandy's guidance and my other mentors there at Wisconsin. And just feel like I've been, you know, incredibly fortunate and to have this career in the last 20 plus years doing work in the area of neurodiversity and autism. And really, I'll just, for those of you who are students, I'll just do a little bio blurb. So I kind of came to an academic career late in life. I went to grad school in my late 30s after a fairly long career of doing political and community organizing of various sorts and different settings. Worked with homeless youth and homeless families and inmates and migrant farm workers and all kinds of topics and issues like that over the years before deciding to go to academia and get a graduate degree and ultimately become a professor. Had a good run as a professor in both social work and public health until 2 years ago. So in 2020, I left academia for a position at Mathematica. Mathematica is an employee-owned company. It's a for-profit company. We have about 1,600 employee owners around the world. And we do research in areas of public health policy, education and human services policy, and international development policy. And it's been really fun. So it's been cool to like get a taste of what life is like doing research in a non-academic setting. And I've learned a lot about that. And I do this anytime I do a university-based presentation, I just kind of do a blank, an open invitation. If you're a student at any stage in your education, I love mentoring. I don't get a lot of chance to do that now because I'm not a professor anymore, but I'm always happy to take emails from folks who are interested in career opportunities in research and trying to figure out whether they should go to grad school, or if they are in grad school, should they go down the academic pathway or a Mathematica type pathway. Anyway, especially if you're interested in disability research, like we need you. We need really great people entering this field because it's not a really like hot field, but it is important. And I hope that if you remember nothing else from today's presentation, that you remember that I am someone, you know, like Sandy, I have a lot of passion for the work that I do. And I feel really lucky to do this work, and we need good people in this field. So I invite you to reach out, and Kate and or Sandy can give you my contact info. So I'm going to share screen. It's been a while since I used Zoom. Here we go. All right, there we go. Can you all Kate, give me a thumbs up? Can you see that screen all right?
Yes, I can.
All right, awesome. Here we go. You know, there's a lot of things I could talk about, and I kind of landed on patching together a little bit of a patchwork quilt presentation for you today. It's going to be kind of a survey of work that I've done in the last 10 or so years. And so it's going to be a high flying. I'm not going to like drill down and talk in depth about one particular study, because I wanted you to understand, particularly if you're in social work, I wanted you to understand like the possibilities of like building a career. You know, oftentimes I know from being a trainee, you often get exposed to people who talk about a particular study. And sometimes it's not always clear when you're in the training stage or the early career stage of your life as a researcher, like, how does that all add up? Like, where does that end up in terms of career achievement? So I kind of thought I'd take a little bit of a different angle than usual, and not talk about a single study, but talk about a family of studies or a group of studies that were funded through the Health Services and Research, the Health Research and Services Administration, or HRSA, which is a federal agency that does fund autism research. And they funded a project that I started when I was in academia at Drexel University called the Autism Transitions Research Project, which is a 5-year project funded 2017 to 22. And we just got it refunded. So we just got reauthorized for another 5 years of funding, which I'm really excited about. So we're going to talk a little bit about the whole collection of studies and how we organized essentially a 5-year program of research and how we thought about that and conceptualized it as a family of related studies. Because I think there's there's a good training perspective there to understand like how investigators put together not just a single study, but also a collection of studies that are integrated and meshed together. And then along the way, I've kind of like dumped in some slides from another presentation, so it might be a little disjointed, but I think you'll get the gist of it. In the course of this large collection of studies, the other thing I did when I was at Drexel was I built what is still called the National Autism Data Center. And so it's an approach to doing research that uses secondary data. And I want to kind of tell the story. There's a sub story about like how we built that data center and why I'm an advocate for population-based research and why I think that's relevant for social work research in particular. All right, move. There we go. So this is basically from the grant that I wrote back in 2016, 2017. We know from lots of research from all kinds of like small psychology studies and studies of all kinds that, you know, positive outcomes and define that any way you want. Just for the sake of argument, let's just use the broad term positive outcomes, understanding that we could argue about that term all day, what that means. But if we just say positive outcomes, whether it's employment, independent living, having friendships, good health, good mental health, positive outcomes happen. They do occur at really all points on the autism spectrum. And we know from tons of studies of adult outcomes from different investigators and different disciplines that if you look at the whole distribution of outcomes in any given study, there's always like some people who are doing pretty well. Even like Leo Connor's early work where he followed up the initial 11 cases in the early 70s that he used to kind of coin the word autism. You know, some of them were doing pretty well and some of them not so well. So we've always known that positive outcomes in adulthood are possible. They do sometimes occur. However, they're not common. Poor outcomes occur for most, again, on any dimension you want to think of. And when I wrote this proposal, one of the things I noted, and this is kind of like a social work soapbox I like to stand on, you know, there's a lot that the work on autism is often has traditionally been dominated by clinical perspectives. And the funding for research often goes towards clinical research. And so we've spent yes, Kate.
I was just going to say, we have a quick question about the formatting of the presentation real quick. Yep. It is, as we go through the presentation, can you include whether autistic people were included in the study / process / program design being talked about at those points?
So I can talk about that. Yeah, so for each individual study, so I'm going to be talking about a whole collection of studies.
Okay, thank you.
Okay. So billions of dollars are spent on research and services each year. However, very little is known about like how things turn out in adulthood and why things turn out the way they do. So we really wanted to try to shed some light on what we could know about how we can improve the numbers of people who are experiencing positive outcomes. We embedded all our work. I've always embedded my work. I was trained as a life course researcher in social work, and I tend to just like to point out, for those of you who are not in a social work tradition of training, that a life course framework really focuses on how individual lives unfold over time, over a lifetime, and how our individual lives are embedded in social contexts. So it's very much thinking about life development in this kind of nested social context. And we do a lot of work looking at social institutions, the impact of systems and policies, the impact of family and neighborhood effects, community and culture and history as impacts on life development. So a digression, a brief digression. So we decided as part of this project to build out this National Autism Data Center. And so why would we do that? So billions of dollars are spent every year on services for people on the autism spectrum from childhood through adulthood. And yet we really, until we kind of got into the business doing population-based data based work, there just wasn't much research at a national level trying to depict and understand like how's life turning out. using large data. And there's another thing in public policy research that every system is perfectly designed to get the results it produces, and systems level problems require systems level solutions. So when I first got into this field of doing work on adolescents and adults in the autism spectrum, in the early 2000s and early teens, I kept hearing people at conferences and stuff using this phrase, like, we need to move the needle on adult outcomes. And so we had the idea that if we want to move the needle on something, well, first you need to move the gauge. We need gauges where you can like measure stuff. Otherwise, we really can't move the needle if we can't see the needle. So we really thought there was a huge opportunity for leadership in this area of doing population level research using secondary data to depict and understand, excuse me, there are sort of three main questions. What kinds of help do people need? What kinds of help are people getting? And what's the gap between what people need and what they get? And then how does life turn out? And so we had this aspiration to become kind of like the main source for useful and trustworthy national statistics on autism. And we wanted to raise awareness using secondary data. And ultimately, we wanted to support decision-making about systems and policies and programs using useful, credible information from a community and national level. So the National Autism Data Center, under funding from HRSA and other sources, has grown enormously since we launched it in 2015, 2016. And we now curate over 4 dozen national data sets of different types. And we organize these different data sets in our data center using a variety of tools. And we kind of track like all the different kinds of variables and questions that can be answered using different data sets. And that core effort of assembling and curating and managing all that data and all those data sets has positioned us to be enormously productive. And so I guess from a career development standpoint, I want to make the point that we have a life course perspective on the life of researchers as well as individuals we work with. And so we as researchers, we also fail or succeed in the context of a system of supports, and we need infrastructure. And sometimes if we don't have the infrastructure we need to do the work we want to, we have to find ways to fund and build the infrastructure that we think will allow us to do the good work we want to do. So point to junior, early career researchers and postdocs and doctoral students, don't be shy of dreaming big, and realize that sometimes when you dream big about your research aspirations, you may need to actually build some of the infrastructure that you're going to need to do the work that you want to do. And that's basically what we set out to do, was to pioneer the development of the infrastructure that would allow us to do dozens and dozens and dozens of studies using secondary data. The main study that I'm going to be focused on today are the factors associated with healthy life outcomes, which is kind of our large secondary data operation. The goal is to expand the evidence base on factors associated with healthy life outcomes so that we could improve transition care and services for this population. We had 4 main aims. One was to provide national leadership and education and research on adolescence and young adulthood, understanding transition outcomes among autistic youth and the role of individuals and communities. Number 3, to increase the supply of ASD transitions research that looks at the influence of the social environment and social context. And 4, increase the supply of useful population-based evidence that can inform policy and community-based programs. So I think before I move on, I'll address the question that came up about the inclusion of autistic individuals in the course of research. So in a lot of the research we do uses secondary data. So that means we didn't collect the data ourselves. We get the data from administrative sources. So we use Medicaid claims data, we use voc rehab administrative data, we use SSI data. So we don't control how the data are collected or how the surveys are developed or anything like that. So no, in that instance, autistic individuals are not involved in the design or the data collection per se of the data that we use to do our studies. In the operation of our ATRP project over the last 5 years and over the next 5 years, We have a variety of vehicles whereby we involve autistic individuals throughout our operation. First and foremost, we hire autistic staff, and I went out of my way. When I was at Drexel, I was quite successful at recruiting autistic graduate students and supporting them with research funding as research assistants and mentoring them in their research and their dissertations. So that's first and foremost. Second, we had a national advisory panel and still have a national advisory panel that includes autistic adults on the advisory panel. Third, for a couple of our major flagship publications, our National Autism Indicators reports, we always had autistic individuals on a specific targeted advisory committee that was specific to each of those major publications. And then fourth, we participated in partnership with UCLA to constitute a panel of autistic scholars. So we've recruited and we pay, reimburse with stipends, a panel of autistic scholars who have advanced graduate training in different fields. And we have quarterly meetings with that panel of autistic scholars, and they review and have input on every stage of our operations, from conceptualization of research questions to methods to grant applications to articles, and in many instances become co-authors on some of our publications. So that's the quick answer to that question. So over the first 5 years, we really were trying to expand the number of people who do this kind of research and who are trained in doing life course research on transition age youth and young adults. And so we had 75 unique co-authors across over 30 publications that we produced in that 5-year period, including postdoctoral students and doctoral students and postdocs, several of whom are on the autism spectrum. This slide is a little out of date, but we're now up to about 40 peer-reviewed publications and 5 national autism indicator reports that have been published off of our efforts for the last 5 years. We had quite a few that were in the pipeline when I did this slide a few months ago, which have now since been accepted. We had a variety of empirical studies, review articles, quantitative studies, several qualitative studies. And I'm going to focus a little bit on the topics. So we cover a lot of topics. And so part of our agenda as life course researchers is to put a spotlight on the interconnection of all these life domains. So we're not really, okay, go ahead.
Sure, I have another question in the Q&A.
Yeah.
Does the National Autism Data Center view self-diagnosis as valid and or include people who self-diagnose in their data sets?
I can't think of a single data set that we have that includes people with self-diagnosis, but I could get back to you on that. So I'm not aware off the top of my head that we have a data set, a national data set that includes people who are self-diagnosed. So building on the social work perspective, where we see outcome domains as interconnected, right? You know, the experience of employment is intimately linked to your experience of economic security and food security and where you live or where you can live. Having good mental health is not simply an individual process, but it's also a function of where you live, whether you're Black or white, whether you're rich or poor. So yeah, we see all these things as interconnected. So we've never really wanted to just do employment research or just do mental health research. We've always strived to do a broad smattering of topics and really, and in so doing, underscore how these things are all linked. And we do a lot of individual studies on particular topics like employment. And then periodically we've used funding from our funders to do these kind of capstone review articles where we synthesize and pull together our findings from across various studies and articles on disparate topics. Anyway, so we've addressed a large number of topics in the last 5 years: service systems and service use, mental health, social participation, healthcare access, financial hardship, and that kind of stuff, public benefits. And well, I'm not going to get into this slide. This is just the tip of the iceberg of a list of article titles and sort of how different articles touch on different topical domains. A few of the key findings. When I take a big step back and I look across the dozens of publications we've done in the last 5 years, there's a handful of like themes that really stand out that I want to share. Basically, rates. I think one of the signature findings that we're proudest about, I'm not sure if it's pride, but that we're most passionate about is educating people about the intersection of poverty and the experience of having a disability. So in several of our studies, we examined the percentage of teens in particular who are living in households at or below the poverty level. We found that the rate is higher than the general population. So roughly 1 in 4 teens on the autism spectrum are living in households at or below the poverty level. And almost a half of teens on the autism spectrum are living in households at or below 200% of the poverty level, which is a rough barometer. A lot of states use that threshold as eligibility thresholds for things like food stamps, free lunches in schools and that kind of thing. So the bottom line is like, we have a lot of people on the autism spectrum in this transition population age range who are struggling financially, and they're living in families and households that are struggling financially. And honestly, that's just not talked about very much in our field of autism research. And we're trying to put that on the table as a topic that we have to address if we're going to do meaningful work, particularly in intervention work and support and improving systems of care for teens and adults on the spectrum. We have to think carefully and thoughtfully about how the experience of disability intersects with the experience of being poor and financially disadvantaged and dependent on social safety net benefits to just get by. So that's a major finding that I'm happy to talk about in the Q&A. We had a number of articles that examined the use of things like SSI, Medicaid, and other safety net benefits. We found very high rates of families, parents, responding affirmatively to questions about struggling to make ends meet, struggling to pay medical bills, struggling to put enough food on the table. Like, these are really common experiences in this population. Another area that doesn't really get enough attention, it's kind of like a widely acknowledged thing, but the implications are not often examined closely. Very high rates of co-occurring health and mental health conditions and use of psychotropic medications in this population, particularly in adolescence and young adulthood. So even though the rates of health conditions and mental health conditions are very high in this population, nonetheless, this population compared to other populations generally experience lower rates of planned healthcare transition from pediatric practitioners to adult practitioners. And so that's an area that we've tried to focus on in partnership with Title V programs and other programs aimed at educating physicians. And there's just really, there's a kind of a weak handoff, if you will, from the child serving healthcare system to the adult serving healthcare system. And we can talk more about the particulars of why that is problematic from a historic standpoint, but it's an area in great need of improvement. Because what happens is autistic teens, they kind of finish high school, they turn 18, and they often lose access to mental health care and sometimes physical health care because they age out of eligibility for those systems. And there really isn't a corresponding competence level and level of provision in the adult services world for health and mental health. We also found that this drop off in access to services actually begins a little before young people leave high school. The kind of conventional wisdom for many years had been that there's kind of a services cliff when people leave high school and exit special education, which is true. But sadly, we also found that the drop off in some of these services actually begins to happen several years before young people exit high school. Another area that we found sort of lacking in terms of how we're preparing young people for leaving high school and entering adulthood is that basically access to job readiness services during high school, internship opportunities, job training opportunities, access to those opportunities are scarce and not nearly as abundant as they need to be for this population. Another sort of feature that we highlighted in a number of our studies is this fact of state-to-state variability in outcomes. And so where you live really matters. So what we find in study after study using different data sets is that, you know, it can hurt you to live in some states over others. And I'm not going to name names right now in this talk, but it's there are some states are doing a better job in terms of health, mental health, and education, and job services, in particular, in coordinating efforts among agencies and sectors, and creating kind of a smoother on-ramp for adulthood and better access to services. And there are some states that are real laggards where people are just struggling to get basic needs met because the systems are not integrated and not functioning well during this transition period. We found that service use across outcome domains vary enormously by race and ethnicity. And that this is, you know, the impacts of historic and institutional racism and discrimination in this population are very poorly studied and not well understood at all. And then last but not least, I want to just highlight that we try to take a systems perspective, and as much as we could with the data we had, we tried to put a spotlight on how systemic issues in terms of policies and procedures, and like state policies and procedures for things like voc rehab, those things also, those factors vary quite a bit by state, and it's variability in these systems level factors that really has an impact on things like access to care and healthcare access. So again, back to this social work perspective, like what's the unique contribution of social work in this area? I think one of the unique contributions of social work is this sort of person and environment contextual outlook. And I think that we could really make more contributions in this area by putting a spotlight on these community and system level factors that influence how life turns out. And how all these domains are interconnected. That we, you know, research tends to parse out by topic, like there's the people who do employment research, and there's the people that do housing research, and there's the people that do research on special education. You know, oftentimes those research communities don't talk to each other, and a lot of times those those studies or genres of studies don't really interact much. But of course, these things all interact in the real world, right? Like special ed and education and healthcare and where people live. If you're living a life, like those things are all connected. And so in general, the field of autism research does a poor job of taking a holistic perspective on these factors and how they all interconnect. And I think there's enormous room for innovation and growth. And I think social work is really uniquely poised to kind of run with that ball and make some winning contributions to this field of autism research by underscoring and focusing on the interconnection among domains and the nestedness of human development in these community and social systems. Equity challenges are everywhere, right? And autism, the world of autism is no exception. So I don't want to keep repeating the same thing, but you know, a lot of the studies that we have done have found racial inequities as well as inequities by socioeconomic status. We also have a small but growing handful of studies looking at the experiences of gender nonconforming youth and LGBTQ youth on the spectrum. There's evidence to suggest that rates of LGBTQ and gender nonconformity are higher on the autism spectrum than in the non-autism population. And so we have a small series of qualitative studies and a couple of forthcoming quantitative studies that are looking at these unique healthcare experiences in particular. So we've collaborated with Kaiser Permanente to launch a series of studies where we're looking at the experiences of autistic adults who also get health services through their gender clinics. And so those studies will be forthcoming the next year. And it's also a very important area, an understudied area that I think social work is uniquely poised to contribute to as well. I'm taking a look at the time here. I'll go ahead and get into this a little bit. So policy and practice. What do I want to say about this? I think I'll circle around. So again, like the unique perspective on issues of policy and practice. So a lot of folks who do developmental research come from more clinical disciplines. They don't really understand systems policy and systems of like organizational practice and community-based practice for how organizations and community-based services are operated. And again, I think this is kind of really unique territory where social work researchers could make a lot of contribution, because we're cross-trained, right? And we have a lot of people in social work who are simultaneously keep like one eye on the picture of like human development at an individual level, but we're also keeping an eye on the formation and management of community-based services and systems of care. We're keeping an eye on the policy context and policy advocacy and thinking about how policy influences the design of community-based services, which in turn influences the life experience of people who need supports, right? So it's that comprehensive, holistic perspective of social work research that I think is especially needed and salient in a population like this, where people do depend on community-based services for assistance and care. And those community-based services do indeed get influenced by policy, particularly at the state level. And those state level policies vary a lot from state to state. So we have a very high degree of variability in how life turns out and the experience of accessing support that varies by where you live. And so I think we really need, we haven't, even my team, like we struggle sometimes to think through, like, how do we pull together a program of research that illuminates the interconnections of these different levels of analysis, you know, the individual life course with the community service access level with the policy level. So I would love to talk to anybody who's excited about that idea of integrating those levels of analysis, because I think that's probably the next frontier that we're going to try to go in. The direction that we want to go in is trying to figure out like how to pull all those threads together in useful ways that can inform policy and practice. We're in the midst of, we've just recently launched, kind of in our final year of this project, we're trying to be responsive to emerging issues. So we've launched a series of studies that are underway right now, examining the experience of autistic individuals during the pandemic. So we have some unique access to Medicaid data through Mathematica. And we're working on some briefs, policy briefs, to inform federal policymakers about the COVID pandemic and how it impacted access to services and health outcomes among autistic children and adults. We've got a series of papers and some projects looking at intersections between the criminal justice system and police and autistic adults. So those are kind of underway. We also really worked hard on our project over the years to really push ourselves to move beyond just being content with publishing our results in peer-reviewed scientific journals. So if I were pressed to develop a logic model that connected the dots between doing university-based research and changing the world, you know, I don't think that publishing articles in peer-reviewed scientific journal articles is like a major pathway of effect. Like I don't often interact with legislators or executive directors of community agencies who are like, oh, I loved your article in JAMA last year. You know, it's just like it doesn't happen much. We need the evidence in those peer-reviewed scientific articles, but how does the evidence make its way from scientific journals into the hands in ways that are useful, into the hands of people that can use that information to actually build great programs and build great services and manage complex systems of care and navigate revising and advocating for policy at federal and state levels? Like it's a very fuzzy area, right? So we wanted to tackle that, and we did. So some of the metrics, you know, we've had a lot of citations of our work by other people doing research. Of course, we always look at that. But we've also had our work directly called out in 2 GAO reports on autism and transition. Our work was pivotal in framing of new provisions in both the Autism Cares Act, but also the Workforce Innovation Act of 2016, which governs the provision of vocational rehabilitation services. And our work was used as some of the basis to argue for a restructuring and financing of state VR services, such that now states have to dedicate at least 15% of their state VR budgets to helping transition age youth. And that was partly out of the work that we did documenting how few transition age youth were accessing VR services on the one hand, versus on the other hand, when young people do access job-related services when they're still in high school, it has an enormous effect size on the likelihood of them getting and keeping a job after high school. We actively court media attention. We do a lot of interviews with newspapers, TV, radio journalists. I've been on NPR a bunch of times. Like, we actively court that. A lot of conference presentations. Before the pandemic, we went to Washington, D.C. twice a year to do an in-person briefing for members and staffers of the Congressional Autism Caucus, which is a bipartisan collection of legislators in DC who focus on autism issues. So long and the short of it is that we really try to push our stuff out into the world. We partner with high leverage organizations, autistic advocacy organizations, disability rights advocacy organizations, state professional associations of national directors, the National Association of State Directors of Developmental Disability Services. We partner with those folks to try to push our findings out through their networks and through their social media accounts. We have kind of an ongoing tickler file of reporters who have identified themselves as beat reporters who cover autism and disability research. And we always send press releases about our research out to those folks. We really try to cultivate these sort of high leverage speaking engagements, keynote speaking engagements to decision-making bodies, and so forth. And we create a steady stream of scientific articles and products. And I'm going to wrap up with a few lessons learned and some recommendations for future research, and then we can open up for questions. Demographics, the socio-demographics of the population are shifting. So we've got a growing, the little bit of longitudinal data we have on this suggests that the rates of poverty or near poverty are growing in this population over time. And likewise, the use of public benefits, safety net benefits, and public health services, so SSI rates, Medicaid rates, food stamp rates, all these rates are going up in this population. So this is a population that as it grows, so too do the number of people participating in social safety net benefit programs, and so too is the percentage of the population that is experiencing socioeconomic distress. The vulnerability in the autistic transition age population is exacerbated by intersectionality of all kinds. I think we've barely scratched the surface of investigating exactly how this intersectionality unfolds and the various points whereby we could do intervention to improve things and help people. So I think that's a growth area. If you're interested in this line of research, I think that we need good people doing great work at this intersection of disadvantage and life course. And we have overall like this, we still haven't cracked the case. Like, how do we improve systems of care? So most of the research on services tends to look at one type of service at a time. The thing about autism is that autism hardly ever comes by itself. Most people on the autism spectrum also have other things. They've got health issues and mental health issues. They need help in a variety of areas from a variety of sectors. So most adults on the autism spectrum who are getting supports are not getting supports from just one provider or one sector or one agency. They're getting help from a variety of sources. What this means functionally is that families and autistic individuals are cast in the role of service coordinators and social workers. They have to like stitch this together and figure out how to patch together, apply for, maintain eligibility for, integrate and coordinate across providers and types of help. It's exhausting. You know, it's really hard. If you've got some complex care needs, trying to get everyone on the same page about your needs and have the different systems interact in ways that are effective is an enormous undertaking. And our systems, the ecosystems in which people with disabilities are kind of embedded, are enormously disintegrated. There's very little crosstalk, very little integration and coordination across different sectors, across agencies and across programs. And it makes life hard. It really makes life hard for people with complex needs. And I think that's an area where, again, we need some really great thinking and great research and intervention at a community-based level. Why is this not working? There we go. We talked about some of this stuff, so I don't think I want to go too deep into this. The last point I think is useful. We do need better interventions that are targeted to marginalized subgroups. So in this latest version of our ATRP project funded by HRSA, we have the most amazing luck. We're partnering with Cristina Lopez, who's a professor at ASU, who Sandy knows very well. And Christina's brilliant. So her work, she's really helped pioneer along with Sandy on developing community-based interventions for young children on the autism spectrum. And so using HRSA funding, we'll be adapting some of those methods to develop a transition era or transition age intervention specific for Latinx families using Christina's operation in Phoenix at ASU. So we're very excited about that. We have a lot of gaps in evidence. I've kind of talked about most of these things, so I'm not going to rehash all this right now. We do need better population level data. So we do a lot of what I would call data advocacy over the years, and I continue that work here at Mathematica. We advocate with a lot of federal agencies, a lot of the big institutional surveys that are managed by the CDC and the National Center for Health Statistics. Many of them don't ask about autism, right? So it's like not even on the radar. And so we advocate for them to include questions about autism so that we can, see people on the spectrum who are in the data and understand what their experiences are with healthcare service access, their financial well-being, their access of public benefits, and that kind of thing. And then data linkage is kind of another thing that we're going to be exploring more of in this next generation of studies that are funded through HRSA. We have there's a big feasibility challenge on the horizon. So I don't want to promise it, but we're attempting to link some different sources of data that will allow us to do some pretty novel analyses of people's experiences, particularly in the health and healthcare sectors. So that's to be continued. We'll have more to say about that in a couple of years. So we talked about the need for service system, like looking at how research that examines like the coordination or the nature of service ecosystems that people inhabit, and not just looking at one service at a time. I think the second point is worth talking about for a minute. So we have like the mainstream services. There's Voc Rehab and Medicaid and state disability services that have been around for a long time. They're ongoing. There's a lot of experimentation happening in communities right now around services for autistic youth and young adults, employment programs, residential programs. I mean, there's just this incredible surge of reform and experimentation happening through community-based groups. That energy is not originating in universities, and there's a real disconnect. There's a lot of innovation happening in the field among nonprofit agencies and family groups and autistic advocates banding together. There's not a lot of research about what's going on, like who's doing what and is it working? How is it helping? How is it helping? So I think there's some careers to be built if anybody's interested in community-based work, building partnerships with community-based organizations that are doing innovative work, helping them to think more clearly about their interventions and their community-based programs, and then collecting data so that we can kind of do continuous improvement of those programs, help them get better over time. I think that's a huge area that's in need of talent and energy as well. We talked about the complex ecosystems challenge, and then increasing the meaningful inclusion of diverse autistic voices in research. So I appreciated that question at the outset. We've made every effort that I can think of and pulled every lever I can think of, but we could probably still do better. So, we're always open to suggestions and always trying to do better on this front. And really, I think if I look back on the different strategies that we've tried, the one that I'm most excited about, frankly, or the two that I'm most excited about, one is the Autistic Scholars Advisory Board. So the Autistic Scholars Advisory Board that we do in partnership with the UCLA, that's a really cool group, and I think that it's not token, it's quite authentic and meaningful. Like we talk with them at length every quarter, and many of them get involved in helping design and author studies and so forth. And then the other thing I think that's just is to grow that cohort. So that's why I've been so passionate about scrambling for funding, usually from philanthropic sources. I haven't had much luck with federal funding, but I've been pretty successful getting philanthropic support to create funded graduate student research assistantships for autistic graduate students, and then really actively trying to court and recruit autistic students and autistic postdocs. So, you know, that's something that we need more of, and I hope that other universities will follow suit on that and prioritize that. It's kind of one of those things where you sort of have to put your money where your mouth is and make it happen. And that concludes my presentation. So I'm going to stop the screen share, take a sip of water, take a breath, and open up for questions.
So we do have a few questions in the chat. One person would like to know if y'all work with the Autistic Self-Advocacy Network.
I know Julia and Ari. I mean, I've known them for years. We don't have at this moment. We've had arrangements with them. We've had funded like projects over the years on and off with them, but I don't think we have a formal collaboration on any specific project at the moment that I can think of.
Okay. And then the next question is regarding dropping of school services like OT and PT and speech in high school. Are there any predictors or risk factors that are found, and what strategies on system levels can be implemented to prevent that phenomenon?
Yeah, it's a great question. You know, I wish I could hold all of our studies like in my brain. We're up to like over 40 published studies now. And honestly, I'm just forgetting the details of that one. So I'm sorry, but I can't answer that. If the person wants to, feel free to give my email address out, Kate, and I'm happy to correspond with that person. You know, I will just say anecdotally from my interaction with dozens of school districts, So here's the deal. So I now live in Portland, Maine, and I just happen to be friends. You know, Portland is a small town. It's like 60,000 people, and we have a school district here that has, I don't know, a few thousand students in it. No, it's not a huge school district. It's not a big city. And there's one coordinator for transition services for all of the city of Portland. When I was in Philadelphia, we had a number of collaborations with the school district for the city of Philadelphia, which is the 5th largest city in the country. In the school district of Philadelphia, they have one transition coordinator for the entire city, right? So there's a resource issue is my short answer. You know, and we see that it's not just the transition coordinator, but it's people who are qualified to provide services to high school students in general who have disabilities, not just autism. There's just a dramatic underinvestment, particularly in poor cities and in poor neighborhoods.
Yeah. I just would, before you go on to the next question, Kate, if people want to actually unmute themselves, Kate can enable you to actually ask your question. So it's not just Kate asking all the questions, because I think it makes it more interesting and interactive for those willing to do that. So if anybody wants to ask their question to Paul and actually verbalize the question.
Yeah, just have to let me know in the chat that you'd like to speak, and I'd be happy to unmute you. So I have
Jackie says she wants questions. Jackie says she would do that.
Okay. All right, I'll hold off on the questions then that are in the Q&A, and I will unmute here. Okay, Jackie, you have a question?
Yes. Can you guys hear me? Oh, my camera's not working and I'm not sure why either, but that's okay. So yeah, my question was, I was just curious if data is available state by state to show how better supports and systems are beneficial, or in some states, like probably ours, I would guess they're causing less desirable outcomes. So I was just curious if that could be used for public policy work and if it's available.
Yeah, unfortunately it's not. We've only had a small handful of studies, mostly using VR data. So voc rehab data is one of the few data sets that we have where we can kind of take a peek into how things operate state to state. And then we complemented the database, which is essentially, it's like the service claims database. It's like the service records of like who gets what kind of services and what are the outcomes. We did a separate study and then linked the two. We did a separate study where we went state by state, doing archival research and analysis, where we studied each state's written documents around transition and the implementation of the Workforce Innovation Opportunity Act, which is a federal statute that required states to develop plans for how they were going to improve services for transition age youth. So we combed like websites and we did phone calls. And we just basically tried to find every document we could in every state to characterize each state's policy activities around improving employment services, voc rehab services for disabled youth more generally. And then we are just in the process of like linking those things together to see if we can see any like effect in the secondary data of states that have more or less specific policies around autism per se. If that makes sense. Sorry, that was a little convoluted.
Yeah, no, that's good. Thank you.
Okay.
That's helpful.
But sometimes that's what you have to do. You sometimes it's almost entirely unlikely you're going to find one data set for any kind of policy question. I'll just step way back because we do a lot of policy research at Mathematica on all kinds of topics. And it's rare that you're going to find a single data set where you want to answer an important policy question that has all your answers. You often have to supplement it with mixed methods. So qualitative work, interviews, focus groups, expert panels, careful qualitative review of documents and policies, as you know, the written documents and policies. Usually good policy research is a multi-legged stool that kind of requires the synthesis and integration of multiple data sources.
Okay, great, thanks. And then I have one more question and then I'm done. But you, in one of the slides, it said there was increased poverty, and I was just, is that as they age or over past
No,
years?
that's looking at repeated cross-sectional data from the National Survey of Children's Health that we can zoom in and look at the percentage of teens ages 13 through 17 who are living in households at or below the poverty level. And that survey is done like every year to a different sample. So it's not following the same group over time. But the rate of young people on the spectrum who are living in households at or below the poverty level has been increasing, and we do not know why.
Okay, great, thank you. Yeah, I was wondering why. All right, okay, thanks. All right, that's all.
I will say that there are other questions in that same survey that are correlational. So the likelihood of living in a household at or below poverty level is highly correlated with other questions about, these are questions to the parents, because it's a parent survey about children with special health care needs. So the questions of the parents are, has anyone in your household had to reduce hours or leave a job in order to care for one or more people with disabilities in your home? Things like that. So there's a variety of these. There's like 5 questions, and I'm blanking on the details of the other questions, but they're kind of these like financial distress questions that look at other things that would suggest like, wow, this family is really struggling with finances, and that's highly correlated with the likelihood that the family is at or below the poverty level.
Great, that makes sense. Okay, thanks.
Okay, we have a couple other questions in the Q&A. Do you have any insights on CBT or behavioral interventions in relation to adult outcomes?
I'm not a therapist. I don't do clinical research. I've been a co-author on a couple of studies with colleagues who are like postdocs who are therapists who've done sort of analyses of lit reviews about things. So I can really only speak at the most distant level about that. What I've been told by colleagues who do that work is that a variety of psychotherapeutic interventions can be helpful for many people on the autism spectrum, particularly for things like depression and anxiety. I will say that the people that I respect the most in the field think critically about those findings. And certainly what we've heard from the autistic adults that we've worked with and who've informed much of the research that we've done, they're like, this is what my autistic friends say. They're like, well, you'd have anxiety too if you grew up with everybody teasing you and ignoring the fact that you have sensory differences. These are folks who, like LGBTQ youth, like who also have very high rates of anxiety and depression. Is it something that's inherent to being queer or something inherent to being autistic? Or is it the fact that these folks experience tremendous stigma and social stress and deprivation of needed resources on the journey to becoming young adults that leaves you pretty anxious? Like, maybe we don't need CBT for some young people. Maybe we need like jobs and social supports to help them be accepted. And maybe we need therapy for the schools and the communities that are stigmatizing and excluding these young people. Maybe they're the ones that need the therapy. So I'm sorry, that's my social work perspective.
I love that.
We have another person from one of our listeners, Jay Kyung, is interested in asking a question.
Okay.
Go ahead.
Hi, thank you for your presentation. I noticed from the chart that topics addressed in the ATRP funded publications, I don't see any like culture related topics there. So I was wondering, how was the cultural aspect of the transition planning and outcomes considered in ATRP research?
Yeah, so this is let me just confirm that I understand your question accurately. So my speaker's not working that great. So are you asking about how were the cultural aspects examined? Is that correct?
Yes.
Okay. So in the secondary data sources, the cultural aspects are hardly ever examined. There's very little data about cultural aspects. We have I don't know, maybe 4 or 5 of our studies, we used survey data where there might have been a question in the survey about if it's a household where English is spoken as a second language or something like that, but very little data in most of our secondary data. So I focused the presentation on roughly 70 or 80% of our effort for the last 5 years has been using secondary data sets, but we also had 2 pilot studies that were funded over the past 5 years. So one of the pilot studies was a study that I designed, which was basically our goal in that pilot study was to develop and pilot test an interview protocol that can be used with different sort of minority outgroups. And the idea was to develop an interview protocol for young adults who can either speak for themselves or families of young adults about the transition odyssey, we call it. So it's a retrospective interview where the goal is to find like people in their early 20s and interview them about their experiences in high school through the transition to young adulthood. And the whole point of this was to put us in a position to be able to translate this into other languages. And to also, so our initial focus was on African-American families in Philadelphia. In the second wave of funding for ATRP, we have funding to take the pilot instrument, revise it, and then work with our Latinx scholar colleagues to translate it into Spanish and deploy that in Hispanic communities. So we're trying to, if we want to understand the unique experience of different subgroups of people and like how their transition experience was uniquely different, then we need like a data collection tool that can help us do that. So I would say we took some first steps in the direction of developing this data collection approach. And my hope is that in the next 5 years, we'll really be able to run with that, refine it, improve it, and actually translate it and begin using it in different cultural minority groups to start shedding light on that.
Yeah, that is wonderful. So another question that actually comes to my mind is that were all the studies that under this project, the data, what the data desegregated into different racial, culture, like a race as a proxy?
Yeah, I mean, in any data set where that race ethnicity variable is available, we usually, include that in our analyses.
So
that being said, I would say, obviously there's a lot of problems with when national survey data. I mean, there's a whole debate raging, right, about like race ethnicity variables and what do they really mean? So if we've been able to document some disparities basically in access to services, but that data doesn't really give you insight, right? It doesn't give you insight into the genesis of those disparities, or like what is the experience that's happening on the ground for people. The nature of the secondary data sources that we use, when we get into race and ethnicity variables, really what we're doing is just saying like there was a difference in outcome or experience for this group and that group as identified by this variable. I find it very unsatisfying, frankly. We do it because it's the best we can do with that data, but it doesn't, at the end of the day, it doesn't really generate a whole lot of insight other than, I think it gives ammunition for advocacy groups. I think it gives us something to stand on to say, hey, we need more resources and we need more research, because look, this group is obviously doing worse than this group. And so, I mean, that's about the limit of, I think, the utility of those kinds of findings. It doesn't really illuminate why those groups are having more difficulty or having worse outcomes. It doesn't illuminate exactly what kinds of policies or programs might help. It just simply observes the fact that one group is worse off than another.
I see. Yeah. Okay, thank you very much. Yeah.
Sure.
And we have one more question in the Q&A. Are there any efforts to get data about those who are self-diagnosed?
Not that I'm aware of. No, it's not. I mean, it hasn't been identified as a priority for my team, nor do I know anyone who's actually pursuing that research.
Okay, great. Does anyone else have any questions that you'd like to place in the chat real quick, or I can turn your mic on? Well, if there aren't any questions, I just want to say thank you so much, Paul, for coming and speaking with us today. I know that I had come across your research without even knowing your connection to Sandy, and I was thrilled to have you be able to come and speak with us here.
Oh, my pleasure. And likewise, Kate, I was quite sincere. Feel free to give my email contact out to anybody who wants to contact me.
Will do. All right. Well, thank you very much. Everyone, there is a link.
I was going to say thank you, Paul, so much for joining us. And next time we'll get you in person. I think we might see you at AUCD conference.
Oh yeah, you're going to be there? Awesome. I'll see you there. Yeah, for sure.
Yeah.
And there is a link in the chat for everyone. If you could please fill out the very brief evaluation after you log off today.
All right. Sounds good. Okay. Thanks, everybody. Good to see you all. Take care.
Thanks.
All right. Thank you.